As far back as 2011, doctors were looking at a connection between hearing loss and dementia, but that focus was on how the lack of communication could lead seniors being less stimulated and more isolated.
Recent study found stronger evidence that people who don't use or have access to hearing aids are at a much higher risk than previously reported. Joining us with more details is clinical nurse specialist and ER nurse Alice Benjamin. Welcome back.
Good morning.
Hi, good morning.
So who participated in the study? What were the results regarding the degree of risk?
So the School of Medicine at University of Michigan looked at over 115,000 adults aged 66 and older. And what they did is they looked at their medical data over a span of 8 years. And what they found was that people who use hearing aids actually had an 18% decreased risk of being diagnosed with Alzheimer's disease and dementia. They had an 11% decreased risk for being diagnosed with anxiety or depression, and also a 13% decreased risk from having injuries from falls compared to people who left their hearing uncorrected.
Okay.
Because they're more tuned into the world.
Yes, absolutely. When it comes to hearing loss, it's a very important and vital sense that a lot of people take for granted. So this was a very relevant study.
Okay, and so you explained the difficulties that folks experience if they don't have their hearing aid in or aren't able to get one. What is the estimated number of Americans who could benefit from hearing aids, but they just don't wear them or can't get one?
Right, so there are over 30 million people in the United States who have some form of hearing loss and would benefit from wearing a hearing aid. But on average, people wait about 5 to 7 years before seeking assistance or looking into getting help from the onset of their symptoms.
You say a big part of the problem is red tape by insurance companies for people who need to have hearing aids. Tell us about that.
Yes, so when someone has hearing loss, it's not as simple as just going to your primary care provider and getting a prescription for a hearing aid. Usually what will happen is there's a delay in you going to the provider, but once you're there, you talk to your healthcare provider of what's going on, and they actually need to do a battery of tests to make sure that your hearing loss isn't related to something medical, isn't something reversible, and even discuss some lifestyle change that may need to occur, like wearing loud ear pods or listening to loud music. And so from the initial visit, you then do a battery of tests. It could include MRIs, scans, hearing tests, and then you're usually referred to a specialist, and then that specialist will then provide you details of what type of hearing aid or device you might need. Now the problem is that many medical insurances do not pay for hearing aids. These are some very expensive devices, anywhere from $1,000 to $4,000 for just a single device.
Right.
And if you don't have healthcare insurance, how do you get screened to even know you need these devices?
Well, the FDA has approved over-the-counter hearing aids. So that seems like something that could possibly lower the cost. More people might be able to get their hands on one. What do we know about that?
Well, what we do know is that the FDA has approved for over-the-counter hearing devices to hopefully to hit markets in next year, 2020. Currently, they're working on guidelines and regulations to make sure that the devices that are approved for these meet certain minimum requirements. Because currently on the market, I mean, if you go to Amazon and look up hearing devices, you'll see sound amplification devices, and those are not the same thing as hearing aids. It's very, very important. People are putting those on, and you can actually cause more damage if they're not set correctly. And Bose actually is working with the FDA on this. I mean, we all know them for their speakers, the quality of their speakers, and they actually have the first FDA approval for an over-the-counter hearing device. And this is going to be critical because you wouldn't think of Bose and the medical industry, but again, by improving someone's ability to hear, you're going to decrease their risk for having dementia, falls, anxiety. I mean, there's lots of social isolation, a lot of things that a lack of hearing can negatively impact someone's life.
Did they talk about the cost of those yet?
So the cost has not been released, but it is estimated that they will be less than a regular hearing aid. So if a hearing aid costs anywhere from $1,000 to $4,000, a little less than that. So, I mean, but it's going to increase access and availability to people who really need them because, again, it removes that red tape with having to go through all of these visits to figure out what kind of hearing aid you need and finally getting one. So I'm all for it.
Okay, Alice Benjamin is an emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website, asknursealice.com. Thanks for coming.
Thank you.
Thank you.